so excited to once again introduce Joanne Cogdell and Michael Sumner.
So I hope Michael is here. I don't see him yet, so hopefully he'll be joining us. But just so grateful to be here with all of you, because it just, is an exciting group of people that I love and appreciate. So thank you for all that you do. We are on the Pokake and Band of Potawatomi lands. I'm also in Indiana. I'm in South Bend area. And I just thought this morning, what do I want you to know about us? I don't know. So it's always hate doing these bios, but since we already had a speaker from Philly, I just want to say that I started in harm reduction in Philly in the 1990s, and it was a very important time for me because I just really appreciate the activist community in Philadelphia that, showed me and everything I know so that when I came here, I had something to bring. I feel like it's very different in the Midwest than it was in Philadelphia. So I am here today, hopefully with Michael Sumner, one of our responders, and Adam Scholes is our CTO, who's not here today, but I just want you to know, as a person who uses drugs, is also an incredibly talented software developer that I am so grateful to be able to work with. So if you don't know who we are, we are growing and changing and trying to figure that out ourselves. But right now we design harm reduction tools to help engage, grow, support, and connect compassionate communities. We are all about creating compassionate connections. And to quote someone earlier, I think somebody said, we underestimate community. And I think we all do that, but I think this group understands the power of community more than most, which is very, very exciting to just have that commonality as we talk. So we believe strongly that the compassionate people are already in our community that want to help people who use drugs in any way they can, support them, connect them, whatever they have to do. But unfortunately, it's not that easy to find those people who can support and help each other and bring them together, particularly in rural communities or in more conservative communities. So we got into this because we believe that's possible, and we are passionate about stopping overdose deaths. We just think that they should not be happening. And although we advocate for a safer drug supply, and that would be way, way, way more effective than anything that we can do, in the meantime, we're tired of watching people die, and they don't need to be dying. So we believe it's time to get everyone engaged in stopping overdose deaths. And you already know it's not about the app, it's about the people. But the app hopefully will get us there. So when we started, we looked at why are people dying of overdoses, and basically figured out that people are, and this is my 10-minute presentation, so we could probably talk about this for a long time, but to try to simplify for this discussion, that people are using with bystanders present, people are using alone, and we have never used alone, we have Brave, we have now, some OPS sites to help people who are currently using alone to make sure that they're not alone. And so we looked at what is needed there to help those people. And then we looked at what is needed to help people who have a bystander present. And that bystander can save a life, but only if they have knowledge, they have naloxone, they carry naloxone, they administer it, and they trust or have a way to reach out for help if that is not working. So those little stats you see there are just based on some of the research, the percentages who are using alone and using with a bystander present, those who are administering naloxone, and those who are actually calling 911. And those statistics are kind of averages of multiple studies. So we looked at that data and we decided, oh yeah, in case you missed that from the last one, that's what we wanted to focus on, finding a trusted way for people to get help. So one of our founders was an opioid user who had many stories they shared with us about watching people die and not calling 911. And so looking at that information, looking at the research, we decided to create our app, Naxos OD, which helps connect bystanders when they see an overdose to someone who can come to the scene, reverse the overdose, and if they need to connect with 911, they can do that. But the person who observes the overdose does not have to. So how does it work? Well, the bystander who has observed the overdose, it's a one button push for them to request help. That request goes out to the closest neighbor responders in our area, and then the responders bring naloxone, provide resources and other support that the person might need to. And most importantly, we just train them to be a compassionate presence. So we launched the app last year. Okay, spoiler alert, we have not reversed any overdoses. That's the first thing everyone wants to know. And it's so frustrating to have to say that, but that is where we are. When we went to launch the app last year, we had a super partner. It was a recovery center for people recently in recovery, a year or less, and 50 residents, and they were really down with supporting us. And then right before we launched, the person retired, and the person who came after them decided they could not work with us because we are a for-profit. So that was really hard for us because we had done a lot of marketing, and so we were like, what are we going to do now? So we decided to go ahead and launch it ourselves, which honestly was probably a mistake on our part, but we just were really, really frustrated and didn't want to wait any longer. So we went ahead and launched and decided we would just keep looking for other partners. So we launched, we got 214 downloads. So our launch area is not even the whole city of South Bend. It is just a 3 mile diameter circle in the downtown section of South Bend. And we used overdose heat maps and where our partners were to kind of determine that area. We have trained 108 responders to this date. 42 of those are currently active. And to date, we have had 4 canceled calls. So four people who did use the app, pressed the button, but then canceled. So did not actually follow through with a call. So I think I shared some of this already, what we learned. For some reason I lost my Zoom. Can't see you guys. Oh, there you are. Okay. So the positive things are that we, again, I'll say it again, is that we even underestimated the community and what they're willing to do, because we figured we needed about 40 active responders to cover this area. And we were like, when we started, like, oh, we knew that we're going to have to reach a lot more than 40 people to get 40 that were actually active. And we were like, how are we going to do that? We have to somehow get hundreds of people to come do this. But we found it was no problem at all. It really, truly was no problem. It is hard to keep people when you don't have any reversals, but it wasn't any problem at all to get people engaged and want to save lives. The other thing that we realized is that as we worked with our health department, EMS, police, treatment centers, harm reduction agencies, there is so much that is not being done. That was completely overwhelming to us. We were just like, we can't, we have to do more because there's just so much that's not being done. So when we started this project, we had looked at every other project that we know and talked to. So we talked to Brave, we talked to Unity Philly, and we talked to Naloxifine, we talked to Beacon, we talked to Pulse Point. And one of the things that we realized was that when you have this two-sided, you need to engage people who are most likely to observe an overdose, and you need to engage people who are willing to respond. We knew that in order to keep them engaged in this kind of emergency app, we needed something else for them to do. But the question was, what is it that they really want to engage in that would keep them using the app so that when there is an emergency, they are engaged and still with us? And so what we discovered is that drug checking and dispatching are 2 critical things that people are very interested in. So we interviewed our 108 responders and asked them if they would be willing to do things that are other than just coming to the scene of an overdose, but things like what we are calling doing opioid prevention, Uber kind of service, like you're bringing test strips and you're bringing Narcan and that kind of thing, but it's not an emergency. Or would you be willing to go canvass a neighborhood when drug checking shows that there is xylazine in the supply and let people know, those types of things? 96% of our 108 people were said, yes, I would do any of these things. We gave them 5 options. And of course, drug checking, I don't know. I don't think I even need to explain that that's critical to people. So we decided those are the 2 things we wanted to add so that the app has value to people outside of just the emergency. And the other thing that we realized is that we really need the right partners to deliver our vision, to be really committed to the vision, to carrying it out. And so those are our learnings. Am I over my time? Just yell at me.
I will. You're good. You still have 2 minutes.
Thank you. So we are like, let's go, let's work on this and get this done. So we have decided to leave the South Bend area. We're still here and our app is up and running in South Bend, but there really isn't anything we need to do to keep it running other than to find the right partner to get it to people who are using and are most likely observed so that they trust the app. I mean, that we need to still work on, but we have everything else that we need going. So we've decided that it's time to reach outside of South Bend and look for other partners. In addition, we are working with the University of Notre Dame to do drug checking in our app. Dr. Myra Lieberman there is a chemist who has created a really exciting test strip for drugs, which is not anywhere near ready for primetime live, but we are working with her to develop that. And we also received an Indiana grant to develop drug checking in our app. So that should be coming soon. We're excited about that. And we are also working on our admin dashboard so that we can be a dispatch app for not just overdoses, but for other reasons that people may be willing to engage in the community and to help share information or resources that can stop an overdose. So here's our vision. We really would like to create a comprehensive harm reduction tool that is trusted by people who use drugs to keep them informed, protected, and connected. And these are the things we would like to add. So we already talked about them, kind of the drug checking, the alerts that go out to the community. So everything we do, all the information that goes into our app, we are not working with any partner who's not willing to put it right back out in the app so that everyone in the community has access to that information, whatever it is. So we also realize our community has a horrible lack of targeted harm reduction information. Some of you talked about that already, about, just making sure that the harm reduction information fits the person and their needs. We have Brave and Never Use Alone in our app in our resource section, but we would love instead to have it highlighted and much more easily accessible in our app rather than something you have to dig through and resources to find. We want to engage community responders, as I mentioned, in more than just the overdose moment. And also, our community has a horrible lack of data distribution and mapping of what is happening with the crisis. And so we've already started working on that as well. So what we need right now is funding. Who doesn't need that? Everybody needs that. But we have gotten some partners that are willing to help us with funding, just a tiny bit, but it's enough to keep us going and moving and developing the app. So we're still looking for more. We are always looking for people who want to adopt the app in their community to engage their community members in outreach efforts to save lives and to provide us feedback as we develop our product. And we are super, super grateful. Thank you. That's the end.
Fantastic. Thank you so much. So we do have a few minutes for some Q&A. So if anyone has any questions, we can raise your hand or throw it in the chat. I'm sorry, I got caught in one of the side threads. I don't even know where we are in the chat. I was like, did I miss questions? Anyone have any questions for the lovely Joanne? I see lots of thanks, etc. All right, so here we go. How do you spread the word about the app?
Well, I have 2 responders and myself. We spread the word about the app, which is not the way to do it, by the way. So we have, it's incredible. We have a number of partner agencies. Oh, I'm sorry, I'm looking at somebody just asked me, I wanted to introduce Michael. I thought maybe he was here and I missed him. So if Michael is here, speak up. Sorry. But yes, we have 2 harm reduction agencies who have supported us with, small amounts of money. We have a methadone clinic who supported us with small amounts of money. All of them agreed, yes, it's a great idea, but there's just not the follow through. And that's why I say, I think we made a mistake by launching, because everybody thinks it's our app and our thing and like we have a harm reduction program with participants and volunteers, which in essence we do, but that's not what we're planning to do. We can't move to another community if we do that. that's why we don't want to do that. But it's been impossible to get people to understand, no, we're not going to push out the app to everybody. We need you to do that. We need you to understand and feel that this has value to you and the people that you reach. And if it does, we're here to support you. But at this point, we've been collecting that data. They've pushed it out to about 22 of their clients, but I myself have done way more than that. So it's just kind of a drop in the bucket, which is why it's not working very well.
Well, and we do that grassroots piece until there's traction, and then it takes, there's always like a tilt point in which it takes off. So that using social media and cross-pollinating in different people's social media. So every time that we see a post from our co-conspirators and collaborators, we try to boost them. These are other ways in which the folks here can also boost the unsupported public relations campaign that needs to happen in order for it to become an actual mechanism for support across the board. And one last question. Curious as to how you're navigating doing harm reduction work as a private company, dealing with the expectations as to being a business. No shade, same boat. Yeah.
Oh no, yeah. The question of being a for-profit is, we get attacked all the time for being a for-profit. How do I do harm? I don't even remember what the question is now. How do I do harm reduction as a for-profit? And I mean,
yeah. How do you deal with the, you have different expectations as a vendor of this kind of service than say a not-for-profit, despite the fact that everybody needs capital in order to do stuff. And if you were a vendor, say you're providing naloxone or test strips, nobody's like, why aren't you a not-for-profit?
Yeah.
But they do when we're actually more community based. So I think the question is, how do you manage expectations?
So Una just answered the question, because that is what I tell them. I usually point to examples of others who, well, first of all, I always say to people, whether I'm a for-profit or a nonprofit, I hope that you will not trust me. I hope you will check me out, and I hope you will see if, what I'm doing has value to you and to your community, and that I'm someone you can trust. Because unfortunately, there are way too many nonprofits that are trusted just because they have nonprofit in front of their name. And that's usually the first thing. And then the second thing I do is exactly what you just said, Una. So in our community, they're trying to develop loss teams. And I just point out to them, the creator of the loss teams, he created an LLC and he gets paid every time he goes out. And he himself is a for-profit, and you have no problem partnering with him. So just challenging people's assumptions of what that means. And I do want people to, scrutinize me and check me over 3 and 4 times, because that keeps me honest and keeps me doing what I should be doing and on the right track. And yes, you should be skeptical of people making money off the opioid crisis, but I can assure you that that's happening in both the nonprofit and for-profit sector.
100%. So accurate. So thank you so much. We've run out of time with our lovely Naxos neighbor peoples, and we are going to give a big round of emoji love for Joanne, please, and thank you.
Thank you. I will put my email in the chat if anybody wants to reach out and partner. I know I am out of time, but I will say that we did one outreach to the next county over. And as soon as we did, somebody immediately picked us up and said, yes, we want to do it. And we're going to do it. So I'm very excited about that. So if you want to join us, please, just let me know. Thank you.
Amazing. Thank you. There's also something to be said for self-determination and how you want to be moving through the world. And sometimes we can get really caught up in, a binary. It's either this or that. We were talking about that in the chat earlier. It's this or that. The idea is we need a comprehensive system. We need a comprehensive mechanism for creating this continuum of care across the board. And there's lots of different ways that can be done and facilitated. And we really need to dig down into the who and why people are doing stuff, and not just hiding behind a not-for-profit as a altruism. Anyway, enough from me on that.